Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Hello, everyone, and welcome to another episode of I Am You. Today, I have the privilege of being joined by Kathleen. Kathleen, welcome to the podcast.
Thank you.
Before we start actually engaging in the conversation about your healthcare, the journey through the healthcare system, I want to actually thank you not only for being brave and wanting and accepting the invitation to be here today to talk about health. No, so as I have mentioned in the past in some of my other podcasts, is we can have conversations about makeups and the new thing in the street, but then when it comes to health, it's so private, it's so to us. No, so opening your heart to share with our audience about your journey is actually something that I don't take lightly, because I know that not only you're making this, you're giving this gift to the world, but also you are doing it so other women can benefit from your story. And today you are the star of the podcast. No, so many times we hear so many experts coming to podcasts, and I want the audience to know that every woman that sits on this chair, every time we record one of these podcasts, is the expert of the matter, because who is a better expert than the one that lives in the body? Yes?
Yes, thank you.
Today we chose you because you have a very interesting story. You want to tell us about how you say that your healthcare situation seems to you like a movie?
Mm-hmm. Absolutely. I sort of think about my story as like a Star Wars movie. You know, I have this portion of my life when I was a teenager when I found out that I had a heart murmur. But there's a prequel to it, in that it probably went back to when I was born or when I had scarlet fever when I was 3. That's the speculation. Also, as I was growing up, I had chest pains. I had like a constriction in my chest. On a number of occasions. I was probably 9, 10 maybe, and I never in my entire life ever told my parents about it.
So, Kathleen, I want to show you here I want to stop you here for a second, because even though we're sitting here today and you are no longer a teenager, the movie star right there. No, you said, you know, when we think about heart disease, many of us think about the disease of the elder. Mm-hmm. Like as we get older, definitely our risk factor for heart disease increases, particularly in women after menopause. However, heart disease does not discriminate by age, you know, and you are the perfect example for that. So who discovered your murmur?
When I was about 17, I had applied for a job at Roy Rogers Family Restaurant, and I had to have a work physical. So I went, and they heard the murmur. Now, it's amazing to me, if it does go back to my birth or my early life, that no one ever heard it before then, but they did. So my parents took me to a specialist, and they determined that it was a valve issue and told me at that point that I would need to have it replaced at some point in my life.
So that early, they already discovered, yes, there's a valve disease that otherwise wouldn't have been discovered if it wasn't because you had to go for that physical, which I understand that you say, well, whatever, I have other doctors that were caring for me, but nobody ever mentioned the murmur. But, you know, a checkup brought up a situation that long-term, somebody warned you, this is going to need to be taken care of in the future.
Yes.
So that early, maybe later on, so that also give you the power to be proactive and knowing that there is a condition that I had to care for, because at some point this eventually is going to become a problem.
Yeah, and that probably makes it sound like I absorbed it more than I did, and that my parents absorbed it more than at that time. I don't know that any of us really said, oh, this is something that's very serious and she's going to have to watch this the rest of her life. And my father was in the Air Force We had 6 kids in our family. We traveled all the time. We, lived in different places. And I had a gazillion different doctors. So it's not like I ever, had a cardiologist from a young age and we really took it seriously and did stuff. At the time that it was discovered, they started me on a regimen for having pre-medication when I went to the dentist, which I've done my entire life. They took me out of gym class, and I had to work in the library, which I think that was probably out of an abundance of caution. They wouldn't let me get my ears pierced, but obviously I did at some point, And in the rest of my life, I did aerobic dance my entire life. I went to the gym 5 days a week before I went to work. So the things that they had told me, I didn't actually necessarily do.
But perhaps because of lack of understanding what was happening, or because you were
wasn't
so
really
young and you
follow-up.
felt good, so there's
Yeah.
I
I didn't have symptoms or anything, And then I went away to college, and then I got married, and
And when do you went back to, I need to get this check again?
I think that it was probably after I'd gotten married, and I was working at a 200-doctor health center. All of our doctors were faculty of the University of Vermont College of Medicine. We were roughly equivalent to the private practices, so I was more in tune with having specialists and that sort of thing. So I started seeing a cardiologist once a year or so then, and it was nothing like what I have now. But
In what sense?
in that I don't even really remember having tests other than maybe a EKG or something like that.
Was that cardiologist aware that you had that congenital
Yes.
valve problem?
Yes. Yeah.
Okay, and
But
he
I-
also warned you that perhaps that was also something that needs to be cared for in the future?
I didn't get that sense terribly. It was really like, oh, yeah, continue to pre-medicate when you go to the dentist, and, yeah, your EKG is fine, and things are sort of status quo, and we'll see you next year.
So for the audience that is listening to this podcast today, the congenital valve disease that you have is called a bicuspid aortic valve. And that is it's not as uncommon as we think it is, no? So the aortic valve is the main valve that allows the blood to get out of the heart to get into the rest of the body. If that valve is dysfunctional and at some point stop opening, that means that there's going to be no blood flow to your body, which is equivalent of death, no? So the aortic valve, for the most part, has 3 leaflets, yeah? So that's what we said is a tri-leaflet valve. And there is a congenital condition where there is not a 3rd leaflet, there's only 2, and then we call it a bicuspid valve. More often than not, those patients will require an intervention on that valve because it's like a fish mouth when it opens. So the little edges, it's like we imagine the lips, so the little edges start getting tight, and then the little center doesn't open anymore. And those patients require special attention because you don't want to discover that that valve is severely diseased too late. You want to be able to identify on time. But in addition to that, there's another issue that might be related to that, which is the aortopathy, which is the aorta can get enlarged. So normally they come hand in hand. So we have to be watching those patients closely because not only the valve at some point is going to need to be repaired, but the aorta might grow and cause the patient might develop an aneurysm that if it bursts and is gone undetected, then that will be a sudden death. So perhaps the time in history, no. They were very proactive with prevention of endocarditis, which is another risk that you had. Whenever you have a structure that is not quote unquote normal, then there is a higher risk of bacteria growing on that tissue, and they were giving you your antibiotics and making sure that before you go for dental procedures, because that's actually is indicated. But it seems like beyond that you never felt that there was a sense of urgency to make sure that you don't miss this, and then that somebody at any point keep doing the checks on you. Until when? When did you finally?
Well, I would say that probably when I moved here, which was about 20 years ago, and I did get established with a different cardiologist at that point because my friends were going there, that sort of thing. And he was following it, but again, it was just, kind of a, once a year type thing. But after a number of years, it became, the opening of the valve is getting smaller, and that could be, it could be due to calcium, it could be due to scarring, it could be due, whatever, but it was getting smaller. And so it was getting to the point that, that sometime in your life was here, it was getting here. So we were following that, and at that time, he was talking to me about the TAVR procedure, where the new valve is delivered through a catheter, if I'm
without having to open your chest, which is a traditional surgical procedure.
Yes, exactly. So, so I was thinking, well, cool, that's, but the problem at that point was that it was not approved for other than people who would not otherwise make it through the surgery. It was primarily for older people, high risk, right? So we were kind of holding out to see if it would get to the point where it would be approved, and it was. But I'm the sort of person that I like to make informed decisions. So I was doing my own. I'm not the sort of person that believes everything you read on the web by any means, and so I had.
Thank God for that.
Yeah, exactly.
We had to be very cautious about what we read and the sources. No, definitely.
Absolutely. So there was a surgeon in Orlando who had come up here to do a presentation, and he brought valves for us to look at and explain the procedures and all that sort of stuff. So. I knew that information. I had the information that my cardiologist was telling me. I, read some things. I started looking into surgeons and hospitals and procedures.
So you were being your own advocate, understanding what are the benefits and the pros and cons.
Absolutely.
Which way should I go?
Absolutely. And so I ended up narrowing it down to a particular surgeon in Orlando, and I made an appointment to go get a consultation with him. So there, I was meeting with the nurse practitioner before I met with the surgeon, and I talked about the TAVR procedure. And he said, I can tell you right now, he's not going to recommend that for you. And part of the reason was because of my age. They considered me young. I didn't consider myself too young, but they considered me young. And the fact that the valve only lasts a certain amount of time. So in about 8 to 10 years, I was going to have it done again. So they felt that it would be better for me to have the open heart surgery at that point, and then the TAVR procedure could be done down the road if I need. I mean, obviously, hopefully, I'm going to need it again.
So the thing is that I wanted to just clarify for the audience as well. When we live in an era which is amazing for to be a patient, this is the time. No, because not only medicine has advanced so much that we have so many treatments available for our patients, options. Of course, not one size fits all. So that's why it's so important to understand who is the patient, what are the criteria, so they meet all the criteria for this procedure versus this other procedure. And the way these transcatheter valves came about is because we have high-risk patients that will never make it after surgery. But eventually that's going to become the standard of care, because ideally we should evolve in a world where you don't have to open the chest of somebody to put a valve. No. However, definitely the consultation is required. How old is this patient? For how long are we expecting that this patient is going to live? And that'll give us an idea of how many valves are they going to need. And so what will be the best approach for them? And that's actually the logistic that went through their heads when you went to visit the surgeon. Now, I do want to... We know that you have the valve. You just said that you hope that you guys do at least go through 2 more. Yes. Yeah, at least 2 more. But all of this, you did not have symptoms.
No.
Yes. No. So that is actually, I think that one of the points that I always like to make is with my patients or people that come to seek an opinion or understanding of their cardiac health is like, if we wait until we have symptoms, maybe it's going to be too late. No. So the idea is that, number one, in your case, blessing that somebody heard the murmur. Yes. Number two, that you continue to seek care to follow up on that so you didn't just drop it there, which is super important for our audience to understand. We're not here making up diagnoses just because we want to make up diagnoses. Like, if somebody tells you there is something that is not right and you should continue following up, then either you believe that person that is telling you that, or you seek a second opinion or try to understand, is this correct and what long-term needs to be done, which is what actually you did. When the moment came and you were supposed to be having the valve replaced, it's like, okay, now what method are we going to use?
Yes.
And then you didn't settle for one recommendation. You try to understand everything, which is super important in the relationship of patient and doctor. Like, we are here to recommend, but our patients also have to be involved because it's decision making. They have to be willing to understand, and then the decision ultimately is the patient. But more important, you end up with a valve, somebody sees you, you're doing amazing, but if you were to be waiting for symptoms, then you might not be discussing this with me today.
And that's an important point to me, because part of the reason that we changed to you from the doctor that we had, when I say we, I mean my husband and I, was that his physician at the cardiologist, when he was probably around maybe 70, told him that, you don't really need to come. He was seeing him like once a year, and he said, you don't really need to come here anymore. Just give me a call if you have problems. And when Alan told me that, I was like, oh, no, that does not work.
Yeah, that will be, give me a call when there's something to repair versus what about we are looking at you and evaluating you and making sure that everything is okay.
Yeah.
So there are a lot of women listening to you today, to your story. And you said, even if I go back in my story and I look, definitely you were born with this. So now in your Star Wars movies, if we had to do episode 3 after episode 7, like they do it, then it will be like the embryo developing that valve. You were born with it. Yes. Yeah. And then it's like you, many others. So for the women that are listening to us today, important that checkups are valuable. Yes. Don't wait until you have symptoms. But if somebody discovers something, that is my message to them. If somebody discovers something, please, 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 please take it seriously. What do you want to tell them?
What do I want to tell?
All of those women are listening.
I would say it's not a death sentence. I mean, when I was 17 and they told me that, I think I probably felt like, oh my God, there's something seriously wrong with me. But probably at the same time, it was like, oh, but it's fine. I don't feel anything. So, and having it done at some point in my life was a long way away. So it didn't, I continued to do all of the things. I led a regular life. And up until the time I had the open heart surgery, I led a regular life. So, it's not like, at least in my case, that it radically changed my life. And even having the open heart surgery, and since, it hasn't really changed my life tremendously.
But would you not have done the open heart surgery if you? Let's say they give you the option of not doing anything for that valve. Would you have done nothing for it?
No, I don't think I would.
Because you want to leave.
I wouldn't have done that.
Because you want to leave.
Just let it go. Absolutely.
And you want to be able to keep enjoying life. No, and then I think that, like you said, it's not a life sentence. Sometimes we think that, we don't want to know because we're scared what can be found. But if you think about what about now? That I love the analogy of the car. What about now that your brakes are not working well, so later on you don't get into an accident. So if you think about your quality of life, all your hard work, your savings, what you want to do when you retire, and now for not getting checked, closing your eyes, you might end up with a very bad outcome, a pretty bad stroke or heart attack that now is like, if only I knew 3 years ago I could have done something different, and now I can be in Aruba or Hawaii or in a cruise, in transatlantic cruise or something like that. So not so much about life or death, although your condition could have become a life or death situation, but also we had to think about our quality of lives.
Yeah.
And you agree?
Yeah. And I did have a pacemaker put in too, which that sort of surprised me. It hadn't occurred to me that was going to happen. And the reason for that, the day after I had the surgery, was because as I understand it, the top part of my heart wasn't speaking to the bottom part of my heart properly. And so I think in the past when I had heard about people with pacemakers, it was old people. And, it was like, oh, my God, pacemaker. And it's been nothing, I mean, I don't even, most of the time I don't even think about having it.
Again, you're never too old to develop cardiac problems. And the remedy 99.999% is going to be much better than not doing anything. And look at you. Today you're here having this conversation with me, and I'm so grateful that you're here today.
Thank you.
Thank you, Kathleen, for sharing your
Thank
story.
you very much.
And this takes us to an end of another episode of I Am You. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD-Dr. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.